If you've ever woken up and experienced dizziness described as the room spinning, now this is a constant spinning. Dizziness that doesn't go away, it's not dependent on whether you lay down or you sit up and like stops, but just constantly spinning for hours or even days. And maybe you woke up, you went to the emergency room, and they would diagnose you with vertigo, sent you home with some meclizine, and you're noticing that your dizziness is progressively improving, but you're still getting dizziness when you move your head quickly, and you're probably noticing some imbalance as well. You may have had a vestibular neuritis. And this is characterized by an acute onset where just dizziness comes out of nowhere. You have this room spinning type of dizziness and progressively improving, and then you're left with this imbalance. So there's a couple things that are happening. One, your inner ear system was affected. So you have one side that's weakened compared to the other one. Now you can kind of imagine if one tire on your wheels or one tire on your car started spinning a little bit slower than the other one, what might happen that would cause a little bit of, would cause a lot of problems with your ability to drive that car, right? Same thing that's happening with the inner ear system. One side's weakened, sending a weaker signal to the brain than the other side, and that's causing this dizziness. Eventually the brain compensates for that, which is why that constant spinning goes away, but you're still kind of left with some balance issues, and you're still left with some dizziness when you move your head quickly. And this is because there's a reflex between the inner ear and the eyes. So when you move your head quickly, it sends a signal to the eyes to go the opposite direction to keep your eyes stable on a target. Now, that reflex is impacted if that inner ear system is weakened. So that's causing the dizziness when you move your head quickly in that later stage of a vestibular neuritis. And if you're noticing that you're maybe walking off to the side or listing off to the side, or you're having more difficulty with your balance when your eyes are closed in particular, that's also because the inner ear system is weakened, and that gives you feedback on where you are in space, especially when you don't have the ability to utilize your vision as much, like let's say a darkened area or when your eyes are closed. So that's kind of the hallmark, kind of classic vestibular neuritis symptoms. And let me note that this is something that will happen. You have one onset, and then it progressively improves, and you may have some symptoms that kind of last a little bit longer, but that is going to distinguish it from repeated onsets of dizziness. So if you're having kind of an attack, it lasts a few days, and then you get better, and then you have an attack again, that's most likely not a vestibular neuritis. So vestibular neuritis, just one onset. There were about 2% of people had another case of vestibular neuritis 2 to 3 years later in a study. And oftentimes that won't be as much characterized as by dizziness as it will by balance issues, because usually it can be the opposite side that's affected. So if you have two weakened vestibular systems, they're both sending a weak signal, so you're not going to have as much dizziness, but you're going to have a lot more balance issues. So it's not as common to have repeated events of vestibular neuritis. And that's going to distinguish it from conditions like vestibular migraines, from Meniere's disease, from stroke, Meniere's disease, vestibular neuritis, or it's going to character between Meniere's disease, vestibular migraines, MS, those kind of conditions from vestibular neuritis. Now, typically, the vestibular neuritis will be caused by, could be occlusion to the arteries going to the vestibular nerve. So if you're not getting blood flow to that nerve, that can then cause a problem with how the nerves is sending signals to the brain, or it could damage it altogether. If you're disrupting how the nerve sends information to the brain. And so it could be kind of what we call a vascular occlusion, where the blood flow is not getting to the nerve. It could be some kind of immunomediated response, where you get these kind of inflammatory mediators that cause a problem with the vestibular nerve. But most often, and what's primarily thought of as what causes most conditions of vestibular neuritis is from a viral infection, and they're thinking usually it's the herpes simplex virus type 1 that's causing the problem. And, you know, there could be other things, but that's kind of the leading thought right now. So, you know, we kind of gone through the symptoms of what you might expect to see with vestibular neuritis, and that reflex between the inner ear and the eyes called the VOR, the vestibular ocular reflex, how that's affected. And people sometimes describe that as your eyes jumping around. And also that you're going to have problems with your balance with this condition. So after the acute phase, the 2 to 3 days up to a week, full recovery often takes up to 6 weeks, but sometimes can be prolonged longer. About 30 to 50% of patients complain of long-term vestibular issues, and even 15% of patients or people with vestibular neuritis may have problems lasting a year or longer with this condition. What's interesting to note is that the severity of loss, so let's say you lose like 60-70% of the function of your inner ear nerve, does not necessarily equate with the symptoms that you're gonna have. So somebody could lose a significant amount of their physiological function of the vestibular nerve, but not be as symptomatic as somebody who lost maybe 20% of that. So what are some of the factors that might indicate that you're going to have these prolonged symptoms? That can be age. So if you're a little bit older, maybe you won't recover as quickly. You can adapt as physiologically back to normal. Initial severity of symptoms. So if your symptoms were really severe in the beginning, that could indicate that maybe you're going to have prolonged symptoms. If you have a fear of bodily sensations, so if you're, especially if you're a little hypervigilant and you're aware of everything and you're kind of afraid of, oh, what's this, what's that, what's this little thing, that could indicate that you might have prolonged symptoms with the vestibular neuritis. And then as also visual dependence, which is something that's very common after you've had some kind of disruption to the inner ear system, is that your brain is going to prioritize that visual information over the inner ear because it's saying, hey, I'm not getting accurate information from the inner ear, so I need to prioritize the vision to help you keep your balance, which is a problem because the vision's easily fooled, right? So if you're walking in a crowded area, you can't visually fixate on some kind of target, which is going to throw you off balance. So we want to get back to utilizing that inner ear, and we do that through exercise, which I'll get into later in this video. So fear of bodily sensations, the visual dependence, and then also what they call autonomic arousal. So that autonomic dysfunction. If you're in that fight or flight response mode and you're high anxiety and it goes along kind of with that hypervigilance, aware of everything and really kind of that heightened nervous system, that can indicate that you might have prolonged symptoms. So another thing that can interfere with recovery is if you have another vestibular dysfunction on top of the vestibular neuritis. So let's say you have a vestibular neuritis and BPPV. So maybe you're noticing that you have that classic onset of symptoms of the vestibular neuritis, but you're also getting the spinning sensation when you lay down and it's lasting less than a minute. Make sure you check out or you test for BPPV and resolve that. And if you need help with that, you can check out my Vertigo Kickstart mini course, which takes you through how to test and how to treat for BPPV. If you want to go through, how to test each canal and the best maneuver for each one of those, you can find the link in the notes below. So make sure you treat that because that's something that can often be really easy to fix. If you have some kind of secondary diagnosis on top of that vestibular neuritis like BPPV, make sure you fix that because that can affect your recovery long term. Also, poor outcomes if you have vestibular neuritis along with vestibular migraines along with vestibular neuritis. That can kind of complicate things and make it a little bit more difficult to recover as well. So we talked about kind of risk factors for prolonged symptoms and what are your risk factors of developing vestibular neuritis in the first place. So, it's thought to be caused by maybe that latent herpes simplex virus or herpes zoster virus. But some of the risk factors that you can control with lifestyle factors are high blood pressure, high cholesterol. That could lead to small blood vessel occlusion, which will impact the blood flow to the vestibular nerve. And if you're not getting blood flow to the vestibular nerve, you can get damage to the vestibular system. Or maybe that just increases that kind of chronic low-grade inflammation in the system, leading to damage of the vestibular nerve as well. Another factor that they found that can put you at higher risk for developing vestibular neuritis is smoking. And then one that was interesting that they found was impaired immune function. They specifically looked at what they call pathological CD4 to CD8 quotient. Now, I'm not going to pretend to know that I'm an expert in that. I'm not. But basically, it's impaired immune response or immune function. So this could lead to a weaker immune response and possibly increased viral infection or chronic inflammation. They found this pathological quotient in almost half of vestibular neuritis cases, and 57% of cases with Meniere's disease and 39% of cases with Bell's palsy. And then they also found that pathological quotient was in approximately 50% of patients with sudden hearing loss as well. So that's kind of something that I'd be interested to look at and see if they come out with more information and some more research on how that can apply or how we can kind of address that, So not my, is an interesting finding in the research, but, that is definitely not my specialty there. So what can kind of put you at risk for having that pathological quotient is what I found is if you have immune deficiency, autoimmunity, chronic inflammation, aging, genetic factors, and sometimes environmental factors as well, that's something to talk to your doctor or another specialist about that specializes in autoimmunity or immune system dysfunction. Now, one study found that 30% of people who developed vestibular neuritis had a common cold beforehand, which kind of makes sense. If you have a common cold, then maybe it travels to the inner ear and can cause a viral infection in the inner ear system. 45% of people had some type of infectious disease prior to developing vestibular neuritis, and typically, vestibular neuritis happens between people in the ages of 30 to 60. So how are they diagnosing this? Now, as a vestibular physical therapist myself, I'm maybe a little bit biased, but from PT standpoint, we take in consideration kind of the timeline of your symptoms and the quality of your symptoms. So what we discussed in the beginning of this video, you have this acute onset. It's lasting for hours to days, and it's constant, not come and go with laying down or sitting up, which would be more BPPV probably. But it's just constant before progressively improving. And then you're left with dizziness, with quick head turns and balance issues when you're walking, when you're with your eyes closed, situations like that. If you're telling us that's kind of what your symptoms present like, then we're going to probably put that vestibular neuritis a little bit higher up, or what we call vestibular hypofunction. So if the inflammatory state's gone away, you could just be left with a weakened nerve on that side, and we call that a hypofunction, one side not functioning as well as the other side. Now, there's some screening tests that we do, so we're going to look at that reflex between the inner ear and the eyes. So I'm gonna move your head side to side. I'm gonna do a quick movement, and tell you to keep your eyes on my nose. If I see your eyes jump off my nose, then there's a high likelihood that is a vestibular hypofunction caused by a vestibular neuritis. Could be caused by something else sometimes, but most of the time, vestibular neuritis, because it is the second most common reason for dizziness behind BPPV. We also look at the dynamic visual acuity, move your head left and right, have you read an eye chart, see if your vision changes between your head still and your head moving a significant amount. And those help us kind of rule out some other conditions, like rare conditions like stroke or autoimmune inner ear disease or some other kind of problem. Other things that people or clinicians may look at are VHIT, video head impulse test. So if we're doing the screening test, moving your head quickly, asking you to keep your eyes on a target, and maybe see something jump off but not quite clear, we could use a VHIT if it's available, which is a kind of a high-speed camera that tracks your eye movement. But not everybody has that. And then ENTs, they can conduct a VNG test that looks at the function of the inner ear. So they'll either put hot and cold air or hot and cold water in your ear to stimulate the nerve. Now, a normal test would be that you get dizzy with it. You stimulate the nerve and it causes dizziness. An abnormal test would be that you're dizzy with one ear, you put a hot and cold air in the other ear, and there's no response, or you're not dizzy at all. So that means you're not really stimulating that nerve and it's weakened on that side. And so if I do the screening test and I see that your eyes are jumping off, there's no need for a VNG test most of the time, because I know what the problem is. We treat it, we give you the exercises, and you progress and you go on your way. If it's kind of like, I don't really see it, and or I didn't really see a problem with the screening test, I'm not quite, kind of sounds like this, but not quite sure, then maybe it might be more appropriate to see an ENT and do a VNG test to kind of rule that in or out, especially if we're considering some other diagnoses based on your presentation or your symptoms. So if you're having these symptoms, what should you do? Now, I'll tell you, if you're having hearing loss along with dizziness, that is a little bit more concerning. It could be just the labyrinthitis, where the viral infection is affecting the cochlea, the hearing organ, as well as the vestibular system. But it could be also something else. So, if you are able to get to an ENT that specializes in vestibular disorders right away, so I mean within the first 24 to 72 hours, that would be ideal, because studies have shown that if you got steroids within the first 24 hours of vestibular neuritis, people 3 months out who had a VNG test showed normal function of the vestibular nerve. Now, if you had the steroids between 24 and 72 hours, that drops down to only 58% of people ended up having a normal VNG test. So it really, the time really matters with those steroids as far as how effective they're going to be in helping. So it's important to find a vestibular physical therapist who can help you guide you through your recovery. Vestibular exercise is going to be really helpful, and we're going to talk about some of those in a little bit. And vestibular physical therapist is going to help you know when to progress, when to rest, how to best get the brain to adapt back to normal, and just kind of give you some reassurance in, okay, these things are normal to expect, or this is not normal to expect. So I highly would recommend you finding a vestibular physical therapist near you. So some of the most common drugs that are given for vestibular neuritis, especially in the beginning, are going to be like an antihistamine. Now, that could be to help maybe reduce some of the inflammation that might be affecting the vestibular nerve. Other ones might be like anti-nausea medication. Other ones might be meclizine, which helps suppress the vestibular input. That's, a lot of my patients say, they gave me meclizine, but didn't really do anything. Well, I'd say don't take it then. If it doesn't help, don't take it. And only take it if you need it. So some people come in and they say I'm taking it every day prophylactically as to help prevent something, but that's not necessarily how it should be taken, because it's going to suppress that vestibular input to the brain, which is, we need that to help recover long term. So the meclizine isn't going to help long term. It's just to kind of get you through if it does help. We talked about the steroids like methylprednisone. May be helpful if you can get it earlier, administer administered earlier rather than later. Antivirals were not really found to be helpful for vestibular neuritis so far, as far as what I've looked at in the research. And then antihistamines, more effective than antivirals, and less sedating than lorazepam for acute vertigo. And then there have been some, sometimes diazepams prescribed as well. I don't know. Not my forte, the medications. Most of the time when people are coming in saying, it was prescribed this medication, they're saying it didn't really significantly help. And then there wasn't one interesting article that I found that talked about what they called nutraceuticals. So kind of like supplements for vestibular disorders. And the most promising one sounded like ginkgo biloba. May help improve circulation to the brain or to the vestibular nerve. But it'll be interesting to see more of that. And then other things, they looked at specific, kind of vitamins and supplements. And they also looked at like the supplement or vitamin alone by itself. But then there are some kind of supplement bottles that have more than one vitamin in them, and then they just package it as this is something for vertigo. It has ginger and ginkgo biloba and this and that and that. It's kind of like a supplement, like a multivitamin type of supplement to take. I didn't quite go down that rabbit hole, as again, that might be better off for a nutritionist or to talk to about that. Wasn't much research or results for those, other than maybe some promising stuff with ginkgo biloba. But what is the most effective thing and the most researched is exercise for vestibular neuritis. So how can we get the brain to adapt back to normal is the question. And exercises are probably one of the most effective, if not the most effective way of getting the brain to adapt back to normal. Now, the exercises that are going to help the most, going to be your best friend if you have vestibular neuritis, is number one, we call it time zone viewing or gaze stabilization. So you have a target in front of you. Usually I write out a little letter on a Post-it note, keep your eyes on the target, and move your head left and right. About 20 degrees left, 20 degrees right. And the goal is to move your head faster as long as the image is staying in focus. So if your eyes start jumping around or it gets blurry or out of focus, you have to slow your head down. If it's in focus, you try to go a little bit faster until it starts to jump around. And that way you're kind of pushing your brain to adapt to a faster motion with keeping your eyes stable. You're training that reflex and it's going to adapt back normal. You want to do that frequently, often throughout the day, like 20 minutes a day. So 3 sets of a minute, 5 times a day. Do a lot of it, okay? So we're going to train the VOR and always do that standing, because it's also a balance exercise as long as you're set up safe in your environment. And then the other thing that we have to do is get the brain to help prioritize that vestibular system more, again, instead of that visual system. So doing balance exercises like eyes closed on a cushion, as long as you put yourself in a safe environment, like a corner wall behind you and a chair in front so you're safe. And then you can close your eyes and turn your head on the cushion to challenge your balance. Walking with turning your head, so looking left for 3 steps, right for 3 steps, is going to help you challenge that inner ear system and decrease your dependence on your vision as well. So all those exercises are going to be great for if you have a vestibular neuritis. It's going to help you progress to recovery faster, help decrease that risk of prolonged symptoms as well. Now, things to be aware of. So tendency that people have with vestibular neuritis is that they stop moving their head and they start getting stiffness in their neck, and then they develop things like cervicogenic dizziness, where this, your muscles and joints send a signal to your brain on where you are in space. And so if you have some kind of impairment in the neck, that can cause dizziness, and it can be a result of not moving your head because you had vestibular neuritis, and whenever you move your head, you're dizzy. So if you completely avoid it, not good, because you're not only going to not be adapting back to normal, because your brain needs that movement to adapt back to normal, but you're also going to end up with some neck issues as well. So whether it's dizziness coming from the neck or just stiffness and pain from the neck, that's something to look out for. Also, a condition called 3PD, so persistent postural perceptual dizziness, can arise from some kind of disruption to one of your sensory systems, like the vestibular system. So it's a condition that has your brain's having a hard time integrating all of the sensory information that it's receiving from your eyes, your inner ear, your feet for your balance and such. And that can cause dizziness as well, when your brain's not integrating all those systems appropriately. And it can often be as well from that like hyper awareness of motion. So, if you're shifting your weight just a little bit normally where we would ignore that, now you're feeling like it's a huge movement because you're just hyper aware. And then the other thing is that when you have vestibular neuritis and your balance is off, you may need to compensate with something like a cane to help you walk, to help prevent falling. Not that won't prevent you from getting back to normal. We want to make sure that you don't have any other medical issues from some kind of problem like a fall. So compensate when it's appropriate for your balance and until you get back to normal. So I hope this was helpful for you. This is kind of like a big rundown, kind of comprehensive thing on our video on vestibular neuritis, things to look at, things to be aware of, what to do for it. If you have any questions, feel free to put them in the comments below, and I'll try to get to them. But thank you for watching, and if you have vestibular neuritis, I'll be hoping and praying that you recover fully from it. If you're just interested in it, and thanks for watching the video. Leave any comments in the questions, or any questions in the comments below, and I'll put some resources in the notes. Thank you.